In this video, I'll be showing you what to expect from a respiratory therapist job interview and what it's going to be like. You know, the question that you might always hear in any interview is, tell me a little bit about yourself. Now, some topics you can consider could be where you were born, your life growing up, what schools you attended, type of work experience you have, any accomplishments, why you decided to become an RT, why you chose to apply where you did. You know, try to tie it in with what you do and try to tie it with respiratory. And, you know, they ask this to know a little bit about you and to see what type of person you are. Say why you got into respiratory care and why you wanted to choose that, you know, as a career. Or another question is, tell me about your clinical experience in school and now at your current job. Now, this is your chance to speak highly of yourself and to explain to whoever's interviewing you all the experience you really have. You know, try not to brag about it or sound cocky, but also let them know why should they hire you. Like, what experience do you have somewhere else that you can apply to their hospital or their clinic or whatever. Potential answers to consider, you know, could be ventilator experience, ICU, floors, ED. Like, tell a story or a situation where you intervened or you did something to make a change or to better the patient, something like that. Describe a time a patient felt as if you went above and beyond for them. So when an interview asks this question, they want to know if you're willing to do more for the patient. They're making sure you're not just doing the bare minimum. It could be an MDI that you show them use and they've had it for a while, they don't know how to use it. You know, sometimes these doctors give them nebulizers, home nebulizers that they don't know how to use. Maybe you teach them that, you know, that's part of our practice, but you know, you may assume that they already know how to use it because they have it, but just make sure they know how to use it. Showing dedication, allowing patients to feel comfortable in the hospital, saying, do you need anything else before you leave the room? You know, little things can make a big difference during a patient stay. Other questions that may be asked: why are you interested in this role? What do you know about the company? It's good to do a little research about where you're applying. They may ask what you know about the company, and they may have certain values that, you know, you want to be aware of, that, you know, hold that standard. Other question that may throw you off is, what are your biggest strengths and weaknesses? You may want to feel like you don't have any weaknesses, but everybody does. You know, just be honest on what you need to improve on and that you know you need to improve on, and let that be known. But also talk about your strengths and what you do best. You know, they want to know if you're willing to learn as much as you can and be a sponge and soak up any knowledge to strengthen your weaknesses. Another question could be, what do you consider your biggest professional achievement? You know, they want to know what have you achieved in the past to make them consider hiring you. Tell me about a challenge at work that you've dealt with. They want to know what situations you've been in and how you handled them. What are you looking for in a new position? Why are you leaving your current role? Hospitals may want to know why you're leaving another respiratory job that you're currently working, and they're curious to why you're leaving that one and why you want to work with them. So it's just little questions like that can throw you off a little, but just think about. So I've actually added a free PDF download. The link is in the bio, of 22 possible RT interview questions, and it's going to be a PDF list of just potential questions with potential answers, and some of them I even included my own answer, but you know, it's just examples for you to refer to, and it includes more than what was talked about in this video. So go ahead and like, subscribe, share it with someone who may benefit from this, and that's the end of the video. Thank you.